The WHO recognized them as global health leaders. But despite all these recognitions and the realization how important ASHA workers are to our healthcare systems, they remain underpaid across states, and there have been struggles for past few years.
These scheme-based welfare projects and scheme-based community health projects, if you look at it like ASHA or ICDS, these schemes are sort of a way of the government sort of washing hands or shrugging responsibility, saying that, you have these, you cannot do away without these social welfare schemes. There is a demand for these schemes. So it's almost like state behaving like a non-state and saying that, we are giving you these services, but let's find poor women from your own community to take care of you, and let's not even pay them well. Let's not even give them the respect of calling them workers. They are in this limbo.
During COVID, we heard everybody from the Prime Minister to everybody talking about how Ashas are the heroes. But it was during the COVID-19 pandemic that they were not paid dues. They were not given their honorarium for many months.
It is not fair that the state governments anymore say that, it's a central scheme. It's not fair. If you take Kerala specifically, if you take Kerala's comprehensive primary healthcare document, it is in the public domain. I think the word ASHA has been repeated about 50 times.
Midwifery, nursing is something which has been enforced on particularly Dalit women across centuries. Okay, and what a coincidence that majority of ASHA workers do happen to come from Dalit communities. The fact that the state sees them as volunteers is such a offensive thing to think about from a caste lens.
The audacity of the state, when I say state here, I mean state governments and the union government, of actually disrespecting 1 million women who are part of your system, who are so crucial to it. You don't want to recognize them as employees. You will not give them salary, but you want them to do everything.
I've seen them on ground in Kerala, and what I find the most impactful is that they humanize the state to a certain extent, where women are the most vulnerable when maternity health and childcare, they come in to check on you.
Even if BJP has propped them up, it doesn't take away from the fact that they are being exploited. They are working in abysmal conditions. So BJP is the opposition in Kerala. The same logic that we apply to political parties elsewhere, right? Congress has every right to support wrestlers, and that doesn't mean that their protest is political. Same, if BJP is propping them up, so be it.
All our glories and achievements in maternal mortality reduction and maternal morbidity reduction and, vaccine preventable deaths, how we have reduced them and all of that, we are heavily indebted to these women who were expected to work for 2 to 3 hours, and now they are full-time workers.
I'm also ashamed that we haven't done enough because, in Bengaluru's Freedom Park, for example, if IT workers come and talk about exploitation, how many people turn up? I hope that, the people who are listening and all of us too will, it shouldn't be left to ASHA workers to protest.